What is hypertension in Ayurveda? And how can we treat this condition according to our science? There is no clear-cut separate chapter dedicated for hypertension in Ayurveda, but there are a lot of classical references. In this video, we have compiled all classical references, seminars, classes and journals. I believe by end of this video, you will get a clear-cut idea about what is hypertension in Ayurveda. Also, we have developed a standard treatment protocol of hypertension in different conditions. Let's get into the video. Hypertension is a somatopsychic hemodynamic condition. Soma means body, psychic represents mind, which says in hypertension both mind and body are involved. And what is hemodynamic? Hem is something related to blood or circulatory system. So remember, here both physical and psychological states are affected. In Ayurveda, we consider it as Sarva Sharira Manoadhishtita. When Kriya Kala is considered, it can be taken as Prasaravastha, the third Kriya Kala, where the vitiated dosha spread from specific site. Let's analyze the components involved here from Vata, Vyana and Pranavata, then Sadhaka Pitta, Avalambaka Kapha and Rakta. These all are in disturbed state. Now let me tell you the coin terms of hypertension. First one is Raktagata Vata, then Siragata Vata, Avrita Vata, Damani Prapurana, Rakta Vikshepa, Vyana Prakopa, Rakta Mada. This is considered as hypertensive encephalopathy or malignant hypertension. Here the person experiences altered consciousness or delirium, and we prefer Mada Murcha Sannyasa line of management. Another coin term is Ucha Rakta Chapa, then Vyana Adibala, Pranavrita Vata, Amashegata Vata. This reference you will get in Sushruta Nidana first chapter. And finally Pittaja Hridroga. So don't get confused when you come across the coin terms. All represents hypertension. Now we will discuss something basics. Pranavata is located at head or brain. Prano atra murdagaha. Reference is from Ashtanga Hridaya. It controls Hridaya. Consider it as sympathetic pathway. This connects brain to heart. Then heart rate is controlled by prana. It does Damani Dharana or arterial perpetuation. Now comes Vyanavata, which is responsible for blood circulation, Krishna Dehajari. And Samanavayu helps blood to return to the heart through Siras. Similarly, Avalambaka Kapha can be considered as heart muscular structure, tone of the heart and blood vessels. When Sadhaka Pitta is considered, think about its guna like Tikshna, rapidness, Drava, fluidity, Sara, diffusion. Due to these properties, it is responsible for sodium, calcium, potassium, ion influx. And finally, quality and quantity of Rasa Rakta Dhatu can correlate with blood volume and viscosity. Coming to Nidana or cause. Reference can be taken from Rakta Dushti Karana from Charaka Sutra 24th chapter 5th shloka and Pittaja Hridroga from Charaka Sutra 17th chapter. The causes are high salt and spicy diet, alcohol, low physical activity and Bija Dosha or family history. Let's draw a hypothetical Samprapti. Before that, just remember there are two types of hypertension, primary or essential and secondary, which is due to another problem in the body. You can refer detailed video here. Keeping this in mind, let's analyze primary or essential hypertension. Due to genetic or environmental or psychological cause, there will be dosha visheshan, which can lead to obstruction of dosha each other, dosha anyonyavarana or dosha with tissue or body component, dosha Dushya avarna. Later what happens is, this vitiated component moves out of their original site, Prasaravastha of Kriya Kala. Vyanavata takes these components and circulates all over the body through Rakta. This in turn hampers the function of respective Srotas and later brings structural changes and leads to Khavaigunnyata. It gets deposited or sthana samshraya in susceptible site, heart, brain, kidneys, eyes and blood vessels, then manifest symptoms which we will see next section. If it is not treated, it will end up in complications. This is hypertensive urgency or emergency or Raktamadha. In case of secondary hypertension, Samprapti of Raktagata Vata can be taken. So when person does Nidana or causative factor, there will be significant increase in Kapha and Medas, the fat tissue. It will vitiate the dhamanis or arteries which cause obstruction to the easy flow of blood. Also due to Vyana Vata Prakopa, the Vayu which circulates all over the body, there will be simultaneously problem in the blood, which results in hypertension or Raktagata Vata. Now we are entering into important section treatment.
Nidana Parivarjana or avoiding the cause is the prime treatment. Next, Shita Pradeha, application of coolant ointment or pouring liquid having cold potency. In Panchakarma, we can go for Virechana, medicated purgation with suitable drugs which pacifies blood pressure. The medicines we discuss next. Rakta Mokshana or bloodletting is another important treatment. Here we are minimizing the pressure buildup in the arteries. This is also a treatment which gives immediate result. Now Basti or medicated enema. This is very helpful in case of secondary hypertension. For example, obesity related hypertension can be treated with Lekhana Basti. Let's try to be more specific, or you can say condition based. First case, due to any sort of edema which cause hypertension in the body, we need to go for diuretic. These Ayurvedic options are Punarnavasava, Punarnava Mandura, Kokshura Churna, Sarivasava, Moringa tablet. In case of stress-related hypertension, we can go with Jatamamsi, Shangapushpi, Brahmi, Muktavati, Saraswatarishta, Yoga and Pranayama. Whereas hypertension resulting from insomnia, stress, mental pressure, options are Shirodhara with Brahmi oil, Tungadrumadi Taila, Chiriya Chandanadi and Kshirabala Taila. Also go with Padabhyanga or foot massage. As vasodilator, we can give Arjunarishta, Lashunavati and Sarpagandha. Some herbo-mineral combinations are Hridayarnava Rasa, Tarakeshwara Rasa and Pravalapishti. Also Dhara is another effective treatment for hypertension. For example, Takradhara with Amalaki Kashaya and Takra where meditated buttermilk poured all over the body from certain height. In Kapha Medavrida condition, example hyperlipidemia, we can go for Mustarishta or Triphala tablet. So I believe you have understand the concept properly, and remember, treatment is always individual based. If you find this video helpful, like, share and subscribe the channel. If you have additional points, drop it in the comment box. We will see you in another health related content.